Hi, it's Dr. Centeno, and I'd like to discuss today a theory of why repeated epidural steroid injections often have diminishing effects over time. So epidural steroids are often used to treat a pinched or irritated nerve in the back or neck, and that condition is known as radiculopathy. However, patients often note that while the first injection helps a lot, the second helps less and the third even less. So why is this happening? I believe it's happening because the high-dose corticosteroids used are toxic to local regenerative cells that help repair and maintain tissue. So let's map out a mechanism for why this probably happens. So radiculopathy occurs when something, usually the disc, irritates a spinal nerve. This is also called sciatica. And while you might not know it, there are resident stem and other cells in the local tissues that play a role in suppressing inflammation and repair. So they're important for controlling symptoms. Now, we know that high-dose steroid used in epidural injections can kill these stem and progenitor cells. We know that based on a ton of in vitro or in the lab type data. Hence, when the first epidural goes in, while there's a big anti-inflammatory effect which helps the patient's symptoms, it also kills off a percentage of these cells. Then when the second epidural goes in, it also kills off a percentage of these cells. So while there's still an anti-inflammatory effect, there's less of a local maintenance and repair effect from fewer stem cells. And then when the third epidural goes in, it really kills off the few cells that are left, so we tend to get even less effect for the patient. So how do we solve this problem? Obviously by substituting a regenerative injection, like our 4th generation platelet lysate, for otherwise toxic steroids. So to find out more, see Regenetics.com, and thanks so much for watching.